Was that digital?
That's real, man. This is all real. Okay, hold on. 3, 2,
Just
1.
wait. Lights good, video good, everything good,
Yes.
audio good.
Yes,
All right.
everything is good. Okay, so we're in the beginning here.
Now I'm ready.
This is the Immorta Bio Podcast, the first Immorta Bio Podcast. It's myself and Dr. Lopez. My name is Dr. Thomas Ichim. I am the President and Chief Scientific Officer of Immorta Bio. Our company is based on treating diseases of aging, and treating aging is disease. And we have Dr. Lopez, who is part of our scientific advisory board and probably one of the biggest influencers in the area of immunotherapy of oncology and as it relates to lung cancer and lung cancer in general. So maybe with that, Dr. Lopez, tell us a little bit about how you got into oncology.
Hi, Thomas. Hi, everyone. Thanks for having me here. It is a pleasure to get the message out about aging and cancer, longevity and cancer, and what we're doing to try to truly conquer this disease. As Thomas said, I'm a medical oncologist. What that means is that I'm a physician that treats people living with cancer. And in addition to that, I do research, which can be clinical or in the lab, trying to create those treatments that hopefully will improve the treatments and the modalities of therapies that we have today even more. The allusion to immunotherapy from Thomas is that I was one of the main principal investigators in the development of a drug called pembrolizumab, which is a checkpoint inhibitor. What it does is that it takes the brakes from the immune system so that a patient's own immune cells can go find cancer cells and kill them. And with that drug, we today have a number of patients who have been living with metastatic lung cancer for more than 10 years. So it truly is an unbelievable achievement. It is unfortunately not true for most patients yet, but there are a number of patients who now are probably hundreds of thousands that have lived much longer with their lung cancer because of these checkpoint inhibitors.
So this is very, very interesting to us. As some of you may know, my background is immunology, and in immunology of cancer has historically been a very controversial field. As you may know, back in the turn of the century, in the late 1800s, actually, people were injecting cancer patients with bacterial toxins to cause a fever, and that's how tumor immunology was born. And then chemotherapy came on. Chemotherapy and radiation was a lot more reproducible. When they were injecting people with bacterial toxins, some would die from the treatment. And then you had different phases where immunotherapy would get hot, then it would become cold, and now finally we live in what I like to call the golden age of immunotherapy. So my question is, first of all, why do you think immunotherapy finally has become the standard of medicine? What makes it different now, the checkpoint inhibitors, compared to everything we as a scientific community have tried before?
Thomas, it's fascinating that you mentioned the story about us causing infections or using bacterial toxins to try to treat cancer. You know what was the first documented possible example of somebody developing an infection and actually having a cancer disappear?
No.
This was an Italian saint in the city of Laziosi more than 800 years ago called Saint Pellegrin, who today is the patron saint of patients with cancer and other diseases. He had a tumor growing in his leg, and that was growing for a number of months and getting worse and causing more pain. And then one night he kneeled down and he prayed to God to try to heal him. And then he developed an infection in that area, in the tumor. And after he developed an infection, the tumor started shrinking and eventually disappeared. So that's the first documented, not scientifically documented, but the first historically documented case, if you will, of somebody who may have had a cancer. Back then, of course, we didn't do pathology tests, so we don't have any way to verify if he really had a cancer or not. And this is the first historical document showing that someone might have had their immune system actually cure a cancer. And then we have a number of case reports. Pasteur actually wrote of people that develop infections and their tumors shrank. Chekhov, the Russian writer who is also a physician, also described cases in which people developed infections and then their tumors, usually sarcomas, actually shrank and in some cases disappeared. So it has been a long time, but it took us even longer to be able to understand the biology. It wasn't until the 60s and 70s, probably from the 70s, with the development of the hybridoma, which puts together cells from the spleen with multiple myeloma cells, and that actually creates a model through which we can generate monoclonal antibodies. And it was those techniques that allowed us to start studying the immune system cell by cell, molecule by molecule. And it is that eventually led to the Nobel Prize a few years ago that was shared for the development of.
Yeah, so the Nobel Prize, Jim Allison's, right? That's the one you're talking about. But,
Yes.
So I want to expand on a point you mentioned. Historically, as immunologists, we used to have to immunize, for example, horses and get anti-serum.